No. Okay, my screen has come on, so we'll be starting in approximately 5 seconds. 5, 4, 3, 2, 1. Good afternoon. My name is Steve Geller, and I'm the mayor of Broward County. I would like to start by saying, as I have said so many times, please wear your masks. You've heard me say it many times. I will continue to say it for another month or two, after which I hope not to have to keep saying that. As I have said many times, and as has been widely reported, our biggest problem has been with our vaccine supply. I am very pleased to say that that problem does appear to be just about over. The state of Florida was receiving 226,000 doses of vaccine, first doses, as of January, when President Biden was elected. Last week, Florida received 817,250 doses. So as you can see, the numbers are increasing dramatically, and that number does not include the vaccine supplies at the 4 mass vaccination FEMA sites, which are coming again through the federal government. And this is the 8th straight week of increasing state vaccine doses. As of this week, Broward County will receive an unprecedented 108,430 first doses of vaccine. Again, this number does not include Walmart, CVS, Publix, and other pop-up state or federal sites. Those are the numbers going directly to the Broward County Department of Health, which is really the Florida Department of Health in Broward County. The numbers are varying widely, somewhere I'd say between about 12,000 doses a day on average and 20,000 doses on average. They seem to continue to go up, but I'd say that we're averaging probably between 15 and 18,000 doses, 15 and 20,000 doses per day. As of now, every senior in Broward County that wants to receive a vaccine has had the opportunity to receive one. As of today, Broward has given at least the first dose to approximately 615,000 people. With about 615,000 residents already receiving the first dose, and our vaccination rate of maybe 500,000 per month now, and with that number increasing each week, it seems clear, as I have been saying, that by the 1st of May, give or take, within 3 or 4 weeks, every adult in Broward County that wants a vaccine will have a pretty good shot of having received their vaccine. And if it takes another week or two for everybody that wants one to have received one, we're getting there. The numbers that I am going to use to predict is that there's just over 1.5 million people, between 1,500,000 and 1,550,000 adults in Broward County. If you assume it's 1,500,000 and a 2/3 number of people that want it, and it's really about 65% is the best polling I've seen. That's about 1 million people in Broward that want it. And again, just if we're at 615,000 and we're doing 500,000 a month, we will reach the 1 million person count in 3 or 4 weeks. We are going, however, fairly soon, I believe, to start having a problem where we're going to be running out of people that want to get the vaccine. We're going to need to start persuading the people that haven't been vaccinated that they need to be vaccinated. the Health Foundation of Broward, in partnership with the Department of Health in Broward, the Children's Services Council, and the Broward County Office of Public Communications, have launched a vaccine awareness and acceptance campaign to educate residents about COVID-19 and the importance of being vaccinated. I have encouraged this group to work with our local municipalities and local elected officials, and Tracy Colari, the Hollywood City Commissioner and President of the Broward County League of Cities, is the city representative to that group. Every county commissioner represents about 240,000 people, but a lot of the city commissioners may represent 5, 8, 10, 12,000 people. And obviously, if you're representing 10,000 instead of 240,000, you can know the 10,000 a lot more easily. I will again say that we are also working with faith-based leaders. It is absolutely critical that everybody get the vaccine. It is critical that people, regardless of their nationality, their ethnicity, or their political party, get the vaccine to protect themselves, their family, their friends, and the community. As you may have already heard, the governor has made changes to the vaccine priority list. Effective this past Monday, the vaccine is now available to all Floridians age 18 and over. This also, that's if you are 16 or 17, you are able to get the Pfizer vaccine only. For those residents that are homebound, the Florida Department of Emergency Management has announced a vaccination program for homebound residents to receive the vaccine at home. Residents can sign up by emailing, and I'm going to say this slowly, I promise, homebound vaccine at EM, that's for emergency management, .myflorida.com, or by calling 866-779-6121. That number again, 866-779-6121 to schedule an appointment. As of April 7th, I've been giving you a lot of good news. Let me give you some not so good news, unfortunately. As of April 7th, Broward County's percent positivity rating is 7.4%. That is higher than the number I gave you at my last press conference, which was higher than the number I gave you before that. This is very concerning. This is being caused by two reasons. Number one is the variants. And I call them the variants, but in Florida, the British variant is now the predominant strain. So, and Broward County has the highest number in percent of the British variant in the state of Florida. So we are the highest county in one of the highest states in terms of the variant. Additionally, people are partying like, the vaccine is, everybody has the vaccine when they don't, and that the COVID crisis is over, and it's not. I think it will be very soon, but it is not yet over. And as a result of this, even as our vaccine numbers are going up, so is the COVID positivity rate, so is the rate of hospitalization, so is the rate of intensive care, so is the hospital COVID count. These numbers should be going down as the vaccinations are going up, but instead they're going up simultaneously. That doesn't make sense, but it can be made to make sense when you understand that the British variant is more contagious, it is more virulent, and people are letting their guard down. And I think if we just last another 4 or 6 weeks, we'll be okay. For reasons that I do not understand, Governor DeSantis has not helped us to contain the spread of COVID here in Broward and has actively made it more difficult for the county, for municipalities, and even for private businesses to enforce rules pertaining to safety. I know, for example, Nova University had announced that they were going to insist that if students wanted to attend classes in person and teachers and their professors wanted to teach, that they would have to show proof of vaccination. And the governor has said that any business that wants to insist that people show that they've been vaccinated or have a negative test, he has outlawed that for reasons that I simply don't understand. Now, when we first started this journey together, Governor DeSantis understood the concerns that we had here in Dade, Broward, and Palm Beach, and let us make our own rules. I don't understand why the same people that say we're not going to do statewide mask mandates because what works in the North Florida rural counties aren't going to work in the South Florida urban counties, will then also say, and I'm not going to let the South Florida urban counties make and enforce their own rules, which he did initially. Again, I thanked him initially for permitting the South Florida urban counties to make their own rules, but we can't do that any longer. There is a light at the end of the tunnels. At the end of the tunnel, I've said this before. You just look at the math. You know, in less than a month, I think we'll have reached 65% vaccination rate, but our numbers are going up. I'm begging people to just be careful for another 3, 4, 5, 6 weeks, and we will be out of this. It will be such a tragedy when people get sick, get hospitalized, or die, when they could have prevented that by just showing a little more patience. We've been in this horrible pandemic for 13 months. We've been locked down for 13 months, although we've been reopening slowly. One more month won't kill you, but moving it up faster might. Let me discuss spring break. It's over. Broward dodged a bullet. We worked closely together between the county and the municipalities, the business community, the bars, the restaurants. We gave warnings. We were enforcing it strictly, and we found that by and large, most businesses were enforcing our orders, and if not, when they were warned, they were willing to obey. And I'm very pleased that we're through with spring break. I am hoping that next year we can tell everybody, hey, Broward is open, come on down. You want to spend spring break here? Great. We were never opposed to spring break. We were opposed to it right now in the middle of a pandemic. Let me discuss some important issues of the reopening of Broward County. As those of you that follow Broward County news may be aware, last Tuesday at our county commission meeting, we voted to begin a reopening process. Let me tell you how this process came about. It is my view, as I have been saying for some time, that we should not arbitrarily reopen on April 1st or May 1st or any arbitrary given date. We should be guided by the science, we should be guided by medicine, and we should have clear and identifiable metrics that will guide our reopening. As part of this, I tried to consult with the North and South Broward Hospital districts, both excellent organizations, but they informed me that this really was a CDC call and they couldn't comment. I spoke with Dr. Paula Thatchy, the director of the Florida Department of Health in Broward County, who's been great through this process, and she said, I'm sorry, that's a CDC call, but maybe you can call Dr. Fauci. He might be able to help you. I called Dr. Fauci. He was great. He called me right back the next day, and we had a nice conversation, and he told me, I'm sorry, I can't really give you those numbers. That's a CDC call. And he said, but they haven't called you yet, have they? And I said, no, sir, how'd you know? He said, well, when I decide to call somebody back, I tell my assistant to schedule an appointment. When they have to decide to call somebody back, they have to go through 5 layers of approvals, and by the time they call somebody back, it's probably too late. But I promise you that they will call you tomorrow. and they did. Thank you, Dr. Fauci. So I had a conversation with 10 people from the CDC. I wasn't expecting that. Had a conversation with 4 people from the United States Department of Health and Human Services. Dr. Paula Thacci was on the phone, and somebody that I did not know existed, which was the epidemiologist for the state of Florida, which again was a position I didn't know existed. So we had 16 people plus me and my staff on that phone call. And I went through what I wanted to know. Here's my proposal. When we reach this percentage and that percentage, we'll do this and that. What do you think? And they said, that's a very good question. Nobody's ever asked us that before. And I said, I find this hard to believe. You're the CDC. Everybody is looking at you for guidance. I'm the mayor of one county, 2 million people in a country of 340 million people. And you're telling me nobody has asked you these questions? And they said, yes, sir, nobody's ever asked us those. But now that you've asked us, we're on it and we'll get you an answer. Or we'll try and get you an answer. So I sent them a letter. I have copies available. I have one. If anybody wants, I can quickly make more copies of my letter to the CDC. It's also posted. It was agenda item 92 on our county commission meeting last Tuesday. I contacted Johns Hopkins University. I sent them a letter. They did respond promptly. Those items are also in the backup for agenda item 92. CDC finally responded without giving me any answer. Their response was telling me to look at their published guidelines, which didn't really answer any of the questions that I was asking. Johns Hopkins did respond and looked at my letter and said, well, we generally like your plan. There are 2 areas which are the which would be reducing occupancy limits at restaurants and at rental halls for restaurants. We would move those from phase 1 to phase 2, and we would also look, instead of the number that you have a percentage, you should also look at the incidence count, because Florida, as I'm sure all of you know, counts our percentage positivity rate different than any other state that I can find, one that makes the numbers look lower. They recommended I use the incidence rate per 100,000, which was, they had a raw number of 48. They recommended that we not reopen until we're below 10, and as of today, our number is 48. So our numbers are really pretty high. If you follow their numbers or the CDC incidents, we should not begin reopening yet. However, the governor has taken away a lot of our ability to enforce our orders. I don't think we should have orders that can't be enforced at all. We still have little ability. We can continue to shut down bars, restaurants, or businesses that violate our order, but nobody wants to shut them down. We need to be reopening our community. So again, I've come up with a metric-based proposal, which was adopted, at least partially, at the county commission meeting on Tuesday. So what we voted on last Tuesday, we voted to lift COVID restrictions on outdoor activities, including capacity limitations, basically immediately. When I say basically, the county attorney needs to draft an order. It needs to be reviewed by county administration and then will be signed by the county administrator. But we expect that by early next week. And when I say lifting restrictions on outdoor activities, we are assuming that this applies to our parks that are not being used for COVID purposes, outdoor swimming pools, golf, all of these other activities. And there is an exception to that, which is one of the things that the county attorney needs to draft. We're still going to permit all of these. However, if it's, for example, an outdoor bar where people may be lined up, almost touching each other, they may still have to wear masks outdoors, but we're lifting all outdoor restrictions. We're lifting, for example, I've had complaints among golfers that the rules say you can't touch the flag, you can't touch the rake. All of those will be lifted by early next week as soon as the county attorney drafts the order and it's signed by the county administrator. Additionally, phase one reopening would include a lifting of the 6-foot social distancing restriction for hotels, lifting of the capacity limits and 6-foot social distancing restrictions on outdoor gatherings, lifting of, actually that's already lifted, lifting of 6-foot social distancing and capacity limits on outdoor, non-professional, organized sports with spectators. The reason I phrased it that way is Florida has already preempted the field on professional sports with spectators. The lifting of capacity limits and 6-foot social distancing requirements at restaurants, lifting of capacity limits and 6-foot social distancing requirements at function spaces. Again, those two, Johns Hopkins recommended be delayed to phase 2, but we are nonetheless opening them as part of our phase 1. Lifting of capacity limits on charter boats, lifting of capacity limits on retail establishments, and lifting of capacity limits on gatherings at private residences. Now, in order to reach phase 1, remember I've been saying metric-based. It's a two-part test. First, we have to have 50% of the county vaccinated, a 50% of the county adult population vaccinated. Well, that's numbers about 750,000, 775,000 right in there. And if we're at 615,000 today and we're vaccinating at 15 or 20,000 a day, you see we're almost there. We should be there within 2 weeks, 3 weeks tops. The second part is a little tougher, although when I came up with these numbers, our numbers had not been going up. The second part is we have to be below 5% positivity rate for 10 consecutive days. Some people have been saying, oh, that's impossible. We'll never get that low. We were that low. Earlier this year, we went, here it is, we went below that number from August 28th to October 25th. Our rolling average, 3-day rolling average was under 5%. And then around Halloween and then into Thanksgiving and Christmas and New Year's and everything else, our numbers, unfortunately, have been going up. And unfortunately, recently, the last 2 or 3 weeks, they've been going up. But if we want to do this on a metric-based, scientifically, medically-based criteria, that's the 50% vaccinated, which isn't an issue. We'll be there very quickly. And then once our positivity rate is under 5%. Now, the reason I made it a 3-day rolling average is you don't want to go 8 days of 4.5%, then 1 day at 5.1, and then have to start over when the next day you're back at 4.5. So it's a rolling average. So it is my hope that we can be at that number in 2 weeks. Could be 3 weeks. If people will just start wearing their masks now or keep wearing their masks, keep social distancing for another 2 or 3 weeks, I believe that we will reach our phase 1 numbers and we'll be able to reopen. Could it be a month instead of 2 or 3 weeks? Yes, but it's not an arbitrary issue. We'll know what the numbers are. The county voted to approve this on Tuesday. We were going to vote on stage 2, which is that includes bars, gyms, and some other things. But when the county commission was voting, I think it's fair to say there were 3 people that would like us to open a little faster. I think there were 3 people that wanted us to open a little slower to follow the recommendations from Hopkins or CDC. And there were some that were in the middle saying, let's open as fast as we safely can. So instead of adopting when we would go to phase 2 and phase 3, all that phase 3 is when you can stop wearing masks. We decided to postpone that until the phase 1 actually goes into effect. And at that point in time, we could immediately say, great, at our next meeting, we're going to reopen to phase 2. We just have to see what happens with the numbers. The last item I wanted to discuss is the American Rescue Plan, which was recently signed into law by President Biden. Under this plan, the county is to receive $378.73 million in funds. It has been slow. We don't really still understand the guidelines under which the funds can be spent, and we're working with our congressional delegation to try and get some flexibility. The Broward County Rental Assistance Plan is proceeding. We recently signed a contract between a new vendor to help residents, work with residents to help them qualify. Our goal is to get people through this in the pre-lawsuit era. We have been finding that very few landlords were accepting our offer to pay 2/3 of the rent arrearages, because as part of that, they would have to agree to renew a lease to ensure that people would be able to stay there for a minimum of 6 months. And many of them simply said no. So we are now have increased that to give them the full amount of their arrearages if they can assure us that the resident will be able to stay there for at least another 6 months. Again, we're working with them to make sure that the rent payments would continue from the county, but we are currently bound by guidelines, congressional guidelines in the American Rescue Plan, and we're working out these details, but I encourage people to contact the county if they are looking for rental assistance. And I will close, as I normally do, by begging people. We're almost there. There is a light at the end of the tunnel, which we're rapidly approaching. Please bear with us. Stay safe, protect yourself, protect your community. Get the vaccine. The vaccines need to go to people of every ethnicity, every race, every political party. Everybody needs to be vaccinated to protect yourself, your family, your community. I know it's hard, but we're almost there. Together, we can fight this, we can beat this. Just give us a little more time, a little more patience, another month or so. I'll be happy to answer any questions. I will put my glasses on because I took them off because they fog up. And here they are. I can't see them without them. I can't see any of you at the back without these.
Hey, Doug.
Yes, hi.
What type of response were you hoping for from the CDC when you consulted them about your plan?
Well, if you looked at the letter I sent, which I sent a letter to all of the 16 people that attended and said, you know, after our discussion, I spoke with the county staff. We came up with what we believe is a science-based proposal for reopening. However, since you are the medical experts, I would like your feedback and hopefully your approval of the following phased-in reopening proposal. And I set it forth, and I hoped that I would get a response from them similar to the response that I got from Johns Hopkins. Johns Hopkins' response was, thank you for reaching out and sending the input. I shared it with Dr. Eric Toner and Dr. Caitlin Rivers from our team. Here's the feedback compiled. We suggest using incidence or hospitalization rates rather than test positivity, move the capacity restriction on restaurants to phase 2, move the capacity restrictions of function space to phase 2. And they wanted clarification when I said 65%, whether that was adult or total population, because they said they weren't sure I'd ever reach 65%. And I said, no, that's adult. So that I was able to clearly, they gave specific comments. CDC's response was, do Dear Mayor Geller, thank you for sharing Broward County's proposed reopening proposal. The state and local authorities can consider CDC guidance when developing their own legislation. That CDC does not publish guidance with the intent that as federal regulatory, we're committed to be available for technical assistance. Please find below links to key COVID-19 prevention guidance and a CDC order that may be helpful to you. Here's the links for more information. They didn't really respond to anything specifically that I was asking, because I guess based on what Dr. Fauci says, there's too many layers that it has to go through to get an answer. But I appreciate they were very courteous to me. They did respond. They just didn't give me the kind of answer that I really wanted. But Johns Hopkins did, and in lieu of CDC, we were trying to follow Hopkins, which basically agreed with my proposal. I can't see anybody back there, so if anybody wants to ask a question, please yell it out, because I've taken my glasses off. Is there anybody else that has a question? I can't see. Is there anybody else? No? Okay. All right, in that case, thank you, and in about a minute, I will give remarks in Spanish.
Gonna give Sven.